vagus nerve. Now I draw only for your understanding, not necessary to draw next time. No, only this diagram. Okay, vagus nerve. It has the same. How many nuclei? 3. Motor nucleus, that is nucleus ambiguous, sensory solitarius, and vegetative no. Nucleus dorsalis nervi vagi, very good. And the same, 2 nuclei, the same like in glossopharyngeal nerve. 3 types of fibers: motor, sensory, and vegetative. And all of these 3 fibers formed one nerve, vagus, nervus vagus, tenth cranial nerve, nervus vagus. And this nerve leaves skull through jugular foramen. That is the same like in glossopharyngeal nerve. And nerve, nervus vagus, in cervical department, pass in space between internal jugular vein and internal carotid artery, internal carotid artery and internal jugular vein. Below, the same pass in space between internal jugular vein and common carotid artery. And on the neck, in cervical department, we have nervus laryngeus superior, superior laryngeal nerve. This nerve consists of motor fibers, sensory, and vegetative. And nervus laryngeus superior go to larynx. Sensory fibers go to epiglottis and root of the tongue. Muscular fibers and sensory fibers go to larynx. Do you remember larynx? Yes. Larynx. And supply muscles of larynx and mucous membrane above of rhimaglottides. And also give branches to pharynx and take place in innervation of pharynx. That is nervus laryngeus superior. The same in cervical department. Vegetative and sensory fibers go to heart and form ramus cardiacus cervicalis superior and ramus cardiacus cervicalis inferior. After that, nervus vagus go to thoracic cage. In front from aorta on the left side and in front of right subclavian artery on the right side. And when this nerve go into thoracic cavity, it gives recurrence laryngeal nerve, nervus laryngeus recurrens, nervus laryngeus recurrens. This nerve consists of motor, sensory, and vegetative fibers. And this nerve go to larynx, and motor fibers supply muscles and mucous membrane below of rhimaglottides. The same sensory fibers and vegetative participate in innervation of larynx and pharynx. That is nervus laryngeus recurrens. After that, below from this nerve, nervus laryngeus recurrens, continuation of this nerve, nervus laryngeus inferior. It is nervus laryngeus superior, it is nervus laryngeus inferior. And inferior, that is continuation from nervus laryngeus recurrens. Below of nervus laryngeus recurrens, vagus consists only from sensory and vegetative fibers. Motor fibers finished in nervus laryngeus recurrens. Below from this level have not got motor fibers, only sensory and vegetative. And in thoracic cage, vagus pass behind of root of the lung into posterior mediastinum and supply esophagus. Right vagus in upper thoracic department pass on the right side from esophagus, left vagus on the left side. After that, left vagus go to anterior wall of esophagus, and right vagus go to posterior wall of esophagus and make network plexus esophagus. From this network start trunks, anterior and posterior trunks, trunci vagalis. Anterior trunk formed mostly from left vagus, but it also has some fibers from right vagus. And posterior trunk, it's formed with the help of right vagus nerve, but it also has fibers from left nervus vagus. And these two trunks, anterior and posterior trunks, that is esophagus, it is anterior trunk, and on posterior wall, posterior trunk, together with esophagus, pass through diaphragm into abdominal cavity. And what happened with esophagus? Esophagus go to what? Stomach. And vagus nerve formed a network. Anterior trunk, truncus vagalis anterior, formed plexus gastricus anterior, and posterior trunk on posterior wall formed plexus gastricus posterior. And from posterior network, from plexus gastricus posterior, start rami celiaci. And this rami celiaci go to plexus celiacus, that is largest plexus, vegetative plexus in abdominal cavity. And from plexus celiacus start branches to all organs in abdominal cavity till sigmoid colon. Go network to liver, plexus hepaticus, to spleen, plexus linealis, small and large intestine, plexus mesentericus superior, plexus pancreaticus go to pancreas, and so on. Clear? All plexus renalis go to kidney. All organs in abdominal cavity receive innervation from vagus nerve till sigmoid colon. In thoracic cage, we have rami bronchialis, rami cardiaci cervicali, rami cardiaci thoracici, rami pericardiaci. All organs in thoracic cage the same receive innervation from vagus. What else? Once again, I want to repeat which muscles receive innervation from vagus nerve. Muscles of soft palate. Do you remember the name of these muscles? Soft palate. Only one muscle not receive innervation. Musculus tensor veli palatini. It receives from trigeminal nerve. All another muscles, levator veli palatini, palata glossus, palata pharyngeus, and musculus uvula. All of these muscles receive innervation from nervus vagus. Next, all muscles of pharynx, except only one muscle. What is this muscle? Stylopharyngeus. It receives innervation from glossopharyngeal nerve. All another muscles of pharynx, they are constrictors, musculus constrictor pharyngeus superior, medius, and inferior, and musculus palata pharyngeus receive innervation from vagus. And last, all muscles of larynx, and upper third of esophagus receive innervation from nervus vagus. That is striated muscles, and all of them receive innervation from nucleus ambiguus, from motor nucleus of vagus nerve. Sensory and vegetative fibers supplies all organs on the neck, in thoracic cavity, and in abdominal cavity till sigmoid colon. And sensory fibers supplies the same root of the tongue and epiglottis, that is from inferior ganglion, and from superior ganglion. Vagus the same has superior and inferior ganglion. From superior ganglion we have rami auricularis, go to external ear, and rami meningi, go to dura mater in posterior cranial fossa. That is sensory fibers from superior ganglion. And again, rami auricularis and rami meningi in posterior cranial fossa. That is sensory fibers from superior ganglion. All another sensory fibers start from inferior ganglion. Something clear? So, I see. Yes, a lot of information that is very difficult and very important. Why it is important? Because parasympathetic innervation present in all examinational cards, in all cards, because each examinational card has question about inner organs: stomach, esophagus, small intestine, large intestine, spleen, kidney, and so on. And all of these organs necessary to answer structure, topography, innervation, blood vessels, and lymphatic drainage. And innervation of inner organ, that is sensory and vegetative innervation. And if you will know vagus nerve, it will be easy for you to describe parasympathetic and sensory innervation of most inner organs. Well, that is all. Now, who will answer mini exam?